Welcome back to Ask Syd. And today we're exploring a very interesting topic, which is an intersection between beauty, sexual wellness, and aging. A lot of us don't realize that as we age, our hormones change after childbirth, especially women, we have a lot of dissatisfaction in the bedroom. But aesthetics and your beauty and your self-image play an equally important role as far as your bedroom satisfaction goes. So today we have two special guests, and it's going to be a two-part episode. It's going to be a very different Ask Syd, where we are going to do a little bit of a show and tell. We have Dr. Jefferson Murdai, who is a PhD in laser physics, who's going to be demonstrating a laser procedure on two people today. And for the deeper conversation today, we have a fabulous and famous Dr. Rodriguez. Welcome, Dr. Rodriguez. Dr. Rodriguez is a cosmetic surgeon. He's trained in Dallas and in the most prestigious school. I'll butcher the names of all the schools and the intros, but more famously, you really have established a very big practice in Dallas, and you've recently moved to Houston, and we are honored to have you as part of our team in Houston at Sydenham Clinic. And the way you approach aesthetics, beauty, and cosmetic surgery is very, very unique, because your whole approach is the whole person, right?
Absolutely.
You believe in rejuvenation.
Absolutely.
But allow you to introduce yourself, please, Dr. Rodriguez.
Okay. Well, I'm Dr. Raul Rodriguez, and I'm a cosmetic surgeon specialized in aesthetic treatments. And to your point, one of the things that I realized early on when I started doing aesthetic treatments was that one of the things that I noticed, because I would do laser treatments as well for beautification purposes, is that women that were on hormones responded better to the aesthetic laser treatments that I would perform. So I delved deeper into that, and I ended up getting trained through the American Academy of Anti-Aging Medicine, got trained on bioidentical hormones, so that people that came to me to look better on the outside would also function better and feel better on the inside in terms of their overall health. Since that time, I've added different modalities, all designed to help reverse the changes that occur as we age and as we get older. And one of the things that's unique about my practice is that I've been able to come up with different protocols and techniques that create synergy, all stimulating the body to repair itself on multiple levels. The most obvious level, of course, as a cosmetic surgeon, aesthetic physician, is going to be the face.
Right.
So there's many things that we can do to the face. And as I mentioned to you before, I was even featured with Barbara Walters back in 2002 with a gentleman that I did a facial rejuvenation treatment on.
And you came on TV with this, right?
Yes, yes.
You were on ABC 2020?
Barbara Walters introduced me as, could this be the answer to your dreams?
Oh.
That's a good introduction. But the bottom line was that I did a rejuvenation treatment, that was over 20 years ago, to help this 65-year-old gentleman look 10 years younger, non-surgically, okay? Since that time, I've added other modalities. We have newer modalities like radiofrequency, ultrasound treatments, stem cells are more popular, exosomes. We have other things that I've incorporated into my treatment modalities to essentially reverse the aging process.
Fabulous.
So,
well, I'm so happy you're here to decode all this for us, because a lot of us hear these things. We have friends who've tried different things. But, at Sydenham, we really believe in bringing evidence-based medicine to our members and to people. But very often, there's a lot of confusion around what's legit. Like I was in Beverly Hills, we're building a new clinic there. And there's a whole movement about anti-fillers, right? They believe in using natural body fat. Fillers are synthetic. So there's so much of controversy around different treatments, and I see what you do is very evidence-based and supported by science. So can you explain to us a little bit, what these non-invasive procedures are, like, the different categories that you're talking about, and then, of course, we'll dive into your whole intimacy enhancement program, and I really want you to explain what they are, because these are some things that we feel shy to ask, and we may not have a comfortable relationship. Like at Sydenham, we have a very good relationship between the doctor and the patient, so they can ask these questions. But very often people don't know who to ask and how do they ask this question. So before sexual wellness, let's just decode some of the beauty treatments.
Okay. Well, one of the things that I've tried to stay away from are fads. Fads come and go. And whatever's being promoted by either on social media or by the company producing a product or a device, it's what the latest rave, okay? So in terms of looking at evidence and what's available and what's good, fillers are very good when they're used appropriately. And when a patient calls or comes to me saying, do you have this machine or do you have this? I said, there's nothing magical about the machine you plug in the wall. Tell me what your issue is, your concern, and then we'll address that. How quickly do you want to see changes? What are you willing to do on your part? What are you willing to invest in your part? To get the look and the results that you want. So there's lots of different components that come into play, okay? The same thing happens with beautification, where fillers are used very commonly. Fillers are safe, especially the hyaluronic acid fillers. I use them in my practice for where it's appropriate. People want an instant improvement, and when used properly, as you'll see from some of the slides that I'll be sharing with you later, it can make a remarkable difference. It can make someone look 5 years younger in about 15, 20 minutes, okay? Yes. Now, having said that, I also use fat, because as we age, our tissues atrophy. Atrophy is the medical term for shriveling up.
Right.
And we lose volume in our face, as well as losing volumes in our muscles, volumes in our bones that lead to osteoporosis. All of these things can be reversed or slowed down with the right type of intervention. For a lot of rejuvenation for the face, since that's probably what they're most interested in Beverly Hills, I also use fat, because fat is a natural product. It restores volume, and fat also has the benefit of containing a small percentage of stem cells. So
and naturally our own bodies produce
exactly.
those.
As a matter of fact, there's some stem cell treatments where the fat is harvested, the stem cells are separated out and grown in a lab, and once they reach sufficient numbers, they can be injected back into the body. Now, the FDA doesn't approve that here in the United States, so people usually have to go to Mexico usually to actually have their own stem cells that have been cultured in the lab, injected back into their body, but those treatments are very effective. So, but the fat tissue contains stem cells. So I use it in the face for volume restoration, but also use it in other areas, like in the hands, for aging hands.
Yes.
You have women as they get older, they don't want to have veins showing on their hands, the skin gets thinner, and then you have age spots.
Yes.
Well, not only do you restore more youthful volume, but also because of the stem cells, the quality of the overlying skin improves as well.
So it's a combination approach.
So it's a combination. So it's just a matter of what the results are that you're trying to achieve, and how you want to employ the different modalities with proven safety and efficacy records, how they can be employed to this particular individual.
Yes. And remarkably, there's research that shows that 91% people, after they get these treatments, their self-image is enhanced. So it's all to do with, like you said, what is the person trying to achieve? Like, so often we feel like we find people with overdone surgeries, but it's their perception, how they look at themselves in the mirror, how they perceive themselves in the social media, right? So you do fillers, and you also do a certain section of your practice is cosmetic surgery. So what are some of the surgical procedures that you do to help us get in, maybe it's the body shaping or fat reduction?
Yes, in my practice I focus more on minimally invasive procedures. I have an operating suite in my office, but I only do procedures that I can do safely using local anesthesia with a little bit of oral sedation. So that makes it safer. You don't have to worry, am I going to wake up, am I going to stop breathing? But you're able to get the treatment that you need with minimal risk, but also that helps me get a better aesthetic result. For example, a lot of what I do is body shaping and body sculpting. I do a lot of liposuction correction, where people have liposuction results that they're not totally happy with. I do all of these things using local anesthesia, because with local anesthesia, once I do my work, and repair what needs to be repaired, I will actually have the patient stand up. The same in my operating room, the same way they were standing in front of the mirror when I was doing the consultation. Because you know that things look different laying down than they do standing up.
Of course,
So
gravity.
Exactly. So not only can I make the procedure safer, but I can get a better final result by being able to do it that way.
Yeah, and I think that's more in line with our Sydenham approach. You know, we're not very extreme. We're very ahead of our times, but we're sort of middle of the road. Like, you know, we like things more natural, more realistic, and that's why, you know, we're so happy that we found a perfect fit in you to establish our aesthetic side of our offerings for our members. Now let's dive into your expertise and your intimacy enhancement program.
Okay.
Talk a little bit about it.
Okay. This part I'm going to whisper.
You have a mic on.
Not on this.
We can pick that up.
Well, to me, I'm very fortunate to have this opportunity to address that, especially for women, because for women, men have had many things that pop up to help us with sexual wellness and sexual enhancement and things like that, but women have been neglected to some extent because women are not as vocal, at least to the public or to other people. They're vocal among themselves, but a lot of these rejuvenation techniques that I can incorporate to make the face look better, to make the body look better, I can also incorporate to help with sexual intimacy, to help things not only look better, but actually function better by using combination approaches, okay? And we can do this both men and for women.
Right.
Okay. To give you an example, since we're talking about men, since men has been the focus primarily over the years, for ED, for men, it's a circulation problem. Things, once again, the atrophy, things shriveling up. The circulation is not as good as it was before. There's some treatment modalities where I incorporate something called low energy shockwave therapy. It's been around for decades.
Yes.
And it's been used in different medical treatments. It's been used to break up kidney stones. You may have heard of shockwave therapy being used.
Right.
For when we do it for helping erectile dysfunction, it's low energy, so it's not strong like for kidney stones, but applying that sort of energy can help stimulate the growth of new blood vessels in the area where the circulation has gotten poor.
And I heard a statistic that 50% of 50-year-olds have ED, 60% of 60-year-olds, 70% of 70-year-olds, and 90% of 90-year-olds. So how old is your oldest patient?
83.
Wow.
83. I always tell people, many times my older patients will come to me, I'd like to do this, but am I too old? And I said, are you ready to get in the pine box?
Wow.
As long as you're not ready to get in the pine box, your body still has the ability to repair itself. If you cut yourself at age 85 or 90, your skin will heal. May not heal as quickly as if you're 9 years old, but it will still heal. You still have the capacity to heal, okay? So we can implement the same things to help that 80-year-old patient restore healthier tissues in the areas where it's appropriate, and also in the process restoring better function.
So a lot of us have heard this and it sounds cool, you know, the O shot and the P shot. So can you explain what really these shots are?
So let me now talk about women.
Sure.
Okay? Enough for men. But women have been neglected to a large extent, and they have not been as vocal. And to some extent, society hasn't listened as well to the concerns of women. And I'm so glad that those things are changing. For women, we use different types of energy sources. I combine those with stem cells, like with the O shot, so to speak, that I do sometimes for women, if that's the case. You can draw your own blood, spin it down, harvest the small number of stem cells in the plasma. So it's like something called PRP,
Right.
but the blood is processed differently. So you also have stem cells in the plasma along with growth factors. And you also have fibrin. So I can use that to inject in this area on the anterior part of the vaginal vault.
Just for lay people, what does that mean?
Okay, we can inject it on the inside just beyond the opening.
Okay.
In an area that's very richly innervated. And by putting stem cells and growth factors in that area, it increases the sensation, it increases the health of the nervous tissue in that area, and in the process, relations become more pleasurable. Okay?
So,
now, having said that, we're talking about making something better. I have one patient that I would like to point out to you to give you the idea of what our bodies can do. And I looked in the journals and looked all over the place to see if there was another case like this. This is a lady that had gotten COVID in 2020, okay? And for 2 years or more, she lost sensation down there.
Post-COVID?
Post-COVID. She actually had COVID and she lost sensation. And she came to me to see if I could help her. Using these different modalities. For her, I used another modality which incorporates shock wave treatments, acoustic wave treatments, to help restore circulation, help rejuvenate the nerves in the area, and I combined that also with the O-shot that you were just talking about. And I was able to restore normal function to her again after she had been numb down there for over 2 years. So the body has a remarkable ability to repair itself with the proper stimulus applied in a safe and effective manner.
So you use the shots and radio frequency treatments?
I used a combination on her, and I timed it so that she had some acoustic waves or sound wave treatments. Some people call them shock waves, so that sounds a little scary, but they're acoustic wave treatments. Then I combine that with radio frequency. Just to back up just a little bit, the body responds in many ways to different heat stimuli. Radio frequency is like a first cousin of microwave, where you can heat up the tissue sufficiently to shock the body into thinking, there's been a burn, we need to make new skin here, or new tissue in a hurry. But we do it without any burning, without any downtime. So we use that also to help restore the vaginal walls, the tissues on the outside, restore the sensory nerves of the clitoris. We can use radio frequency in that regard as well to help shock the body into making new tissue where it's perceived there was an injury. The nice thing about this, they're not painful.
Right. And, let's just let our users know, like some of the top 3 problems that women face after childbirth, menopause, now you're saying COVID, or because of hormonal changes, is a lot of women experience a lot of dryness, which makes sexual intercourse very painful for them. Sometimes women have difficulties in orgasming, and they don't get orgasms very easily. And the third issue is urinary incontinence, right? Some of these things can lead to not being very continent. So can you explain like how all these problems are addressed through some of the treatments that you do?
Okay, let's, since we're talking about radio frequency and introducing heat, okay? The urethra runs right over the top part of the vagina. That's where the opening is, just above the vaginal opening. So there's tissue between that little tube that drains the urine and the vaginal walls on the inside. By strengthening the tissues from the inside of the vagina, you're providing more support to the urethra that's coming down over the top. So by stimulating growth of healthier, tighter tissues, you can actually provide more support to the urethra, the tube that drains the bladder, and you have less urinary stress incontinence. So it's a way to alleviate mild urinary stress incontinence.
So it is vaginal tightening what you're trying to achieve.
With vaginal tightening, you can also help the urethra. So you get dual benefits to that. And then, of course, you get the other additional benefits in helping to restore the nerves, improve orgasm, improve lubrication. For example, I have patients that are on anti-estrogen therapy because they may have had estrogen-positive breast cancer and had to have mastectomies, and then they get put on anti-estrogen therapies. I've been able to use the radio frequency treatments to alleviate the dryness without them having to get on any hormone that may cause concern for having a recurrence of the cancer.
Wow. Well, thank you so much. Thank you so much for shedding light on this. I know you're going to be back on Ask Syd, and we're going to bite this off like in smaller chunks, because it's, you know, we want to learn all about Botox, we want to learn all about lasers, but we'll do it one topic at a time. And I think for today, we've got a good introductory sense of, you know, this is a problem that we shouldn't, you know, hide and not talk about. It's okay to address it. It's very safe. It's not like you're going into surgery center and you're doing something which you can't reverse. It's minimally invasive. And I think your whole confidence, your relationship, your sense of self, they all impact intimacy. I think intimacy
Absolutely.
is something, and we know that in the blue zones, like one of the biggest things that lead to a long life is strong emotional relationships, and to strengthen
very
that
true.
bond with the one you love the most or your partner. I think if we can contribute to that by leaning on science and technology, and it's good timing. I think we shouldn't be scared of it.
I think it's wonderful. You know, we talked a lot about the technical things of what I do, but the most satisfying thing for me is the changes that people experience and how they feel about themselves, how they feel in those relationships. Because I think that's what's important in life, and that gives me the greatest satisfaction when someone can tell me, Dr. Rodriguez, you've changed my life. Yes, they're not worried about radio frequency or sound waves. They're worried about the fact that their life and the quality of their life has been improved.
Yes, I see. Your patients really have an intimate relationship with you. You really value the doctor-patient relationship.
Absolutely.
And thank you for that. Thank you for all the great work you do. Thank you so much.
Well, thank you for having me. It's a pleasure to be here.
Thank you. So until next time, remember, health is by choice, not by chance. Keep sending us your questions and tune in to the part 2 of this episode where Dr. Mardai is going to be showing you some of these aesthetic laser treatments. Thank you.